Hi. What do we want? When do we want it? Everybody in. Everybody in. Let me tell you something. As a matter of policy and economics and morality, the argument's over. Single payers won. Expanded and improved Medicare for all has won. If it's wrong, as our DC Democrats tell us, to throw off 23 million people from coverage, then it's wrong to leave 25 million people out of coverage still. And it's wrong to increase junk insurance by further limiting the networks, by further raising premiums, raising co-pays, raising deductibles, have more people be afraid to get the needed health care due to out-of-pocket costs, to still allow medical bankruptcy, and wrong to make even worse, well, then it's wrong to ignore all of those problems of underinsurance that still remain. If it's a matter of morality, you believe as I do that health care is a human right, and that to really make America great, that everybody in America should have straightforward, easy access to health care, that automatic enrollment paid for by progressive taxation is the only answer. Let me hear you say it, everybody in! If it's a matter of policy, you understand how health insurance, health care financing, and the health care system actually work, then you know that continuing to promote a system of fragmented for-profit insurance pools where the for-profit private companies compete only to not cover sick people, that system cannot work and cannot be fixed. Only single, all-American health insurance pool paid for by progressive taxation can actually automatically cover everybody and, yes, also save money. So if your goal is to actually have everybody in America covered and reduce total system costs, the total cost to families, the total cost to individuals, then I tell you again, only single payer, expanded and improved Medicare for all is the real first step to get us there. And let me tell you something. This is not just a narrow, single-minded, single-issue fight. We stand here together for the fight for equal rights for all, against runaway wealth and income inequality. We are here for the fight for 15 and a fair living wage and jobs for all. We're here for Social Security and improved pension benefits and retirement benefits. We are here for organized labor, for affordable housing, for education for all, a clean environment and clean energy, for voting rights and equal fair representation throughout the political system. And underlying all of our interrelated social, economic, and political goals that get big money out of politics. Because it's all one big fight, and we're all in it together. So let me hear you say again, everybody in, and nobody out. I hate to get all wonky on you, but by the way, the economic specifics for single payer are in fact all laid out in our proposals for those who care to look. There's been a lot of concern trolls in the punditocracy lately. Let them do their research. We know that single payer proposals have detailed financial and economic analyses for over 20 years. Independent academics at MIT and Harvard and Princeton, UMass, and go look it up, the Lewin Group, which all the parties have called the long-time gold standard in healthcare financial analysis. Let me tell you something. They all agree. The only way to actually get everybody covered, save total system costs, save out-of-pocket costs, total cost for families and individuals is single payer. It's our current system of premiums and co-pays and deductibles that are unsustainable and unfair. It's the most regressive tax we have. It's the same for the average worker and for the CEO. It doesn't get more regressive than that. The fact is that with single payer expanded through Medicare for all, whether it's the New York Health Act in New York or HR 676 in the National Congress, the savings, total costs go down for 95 to 98% of the people. The savings from no more premium, no more co-pays, no more deductibles are vastly greater than the increase in taxes for all with the 2 to 5% highest income, myself included, by the way. We can afford it. And yes, savings from no lowered administrative costs for both the insurance financing side and on the delivery of care side, from the monopoly of buying power, and all the other technical ways that this simple, straightforward system saves money. Let me tell you something, they're proven real. We know they work. We know they're real. They're already in action in various forms in Medicare. 4% overhead compared to 25% overhead. Medicaid, DOD, the VA, and by the way, the healthcare system in every single other developed, rich, capitalist country in the world. They all do it. Only America does not. So let me tell you something. Single payer brings real freedom of choice. For the choice that matters. Not the choice of insurance, but the choice to have actual health care. Let me tell you, we can have, I know some of my friends here may not like it when I say that we actually could have the benefits of real marketplace competition. When we, the people, now actually have access to 100% of open networks of all the doctors and hospitals and clinics, when they are competing to take care of you. That's real healthcare freedom. The real savings, of course, is peace of mind. Peace of mind that you and your family, your neighbor, your brother, your sister, your cousin, the person you don't know down the street, that everybody has access to care. So let me hear you again. Everybody in, nobody out. You know, inadvertently, the threat of the current administration and the current Congress, these right-wing ideologues, it's actually been educational for America and for the media. Now more Americans than ever support the role of government to assure access to care for everybody. Over 60% of Americans, and yes, let me tell you something, over 55% of my fellow physicians support this. You know, it doesn't even need to be a partisan argument. You may have heard of Bismarck. They don't come more conservative and right-wing than Bismarck. Well, Bismarck helped bring universal health care to Germany in the 1800s. Favor of the role of government to provide universal health care. The conservative business case for true universal coverage is made by the fact that, again, every other industrialized capitalist country, Canada, Germany, France, Australia, Taiwan, Japan, all have it. The only corporate losers are the health insurance companies who we put out of business. The drug companies who would have to settle for only getting the same rates on their drugs as they're paid for the same drugs from the same multinational corporations in every other rich country in the world. By taking the issue of healthcare coverage off the table and making healthcare a fixed and fair cost of business, it's good for every other business and every business person. Let me tell you, I welcome business leaders and politicians of every party at every level of government to support single payer. It should not be a partisan issue. And therefore, we must challenge every Republican who is opposed to Medicare for all. And you know what? We must challenge every Democrat who does not really stand for us. Yes. Because again, if the argument against the Republican plan is that it's wrong to increase the uninsured and the underinsured, then it's wrong to still leave so many behind now. So let's say it again. Everybody in.